In this session, we are going to look at a kidney specimen taken from a 54-year-old woman who had recently been diagnosed with an advanced carcinoma of the cervix, for which she had been receiving radiotherapy. The patient developed dysuria, or pain when urinating, frequency and scalding upon urination, followed by severe colic in her loins. Prior to her death, a midstream specimen of urine revealed a significant number of neutrophils, red cells and red cast cells, as well as several species of bacteria, which is suggestive of a severe level of infection. Macroscopically, we can see a bisected kidney. The renal pelvis, this area here and here, calyces, these small white regions here, and upper ureter here have also been opened. The cortex is of reasonable width throughout, and the junction between the cortex and the medulla here is clearly demarcated. However, areas of congestion in the renal pelvis here and ureteric mucosa are indicative of acute inflammation. Most of the medullary pyramids here are also grossly abnormal. We can see that these pyramids, which are yellow and white in colour, have begun to separate from the rest of the kidney. And this is indicative of a severe level of renal papillary necrosis following an acute bacterial infection, also known as acute pyelonephritis. Microscopically, we would expect to see evidence of inflammation throughout the renal parenchyma, the entire renal tissue, as well as areas of necrosis and abscess formation in the medulla or lower cortical regions.
Next, we will discuss the microscopic appearance of renal cell carcinoma, also known as Grawit's tumour. This is a low-frequency tumour representing only about 2% of all cancers. However, it is a high-frequency tumour in the kidney, representing upwards of 90% of tumours that affect the kidney, generally affecting one pole in a unilateral system. The pattern or key characteristics of the microscopic structure are referred to as an acinar or glandular pattern. Again, a hematoxylin and eosine stained section taken from the developing tumour shows a proliferation of tubule epithelia, and this is characteristic of this cancer. Here we have examples of several tubules and epithelial cells which have grown enlarged, typical of the proliferation of these tubular epithelial cells. Another characteristic is that these tubular epithelial cells, these large voluminous cells, contain very little material which has been washed out during the preparation of these slides. Other than the nucleus, which is very prominent, these cells are quite empty. Hence, pathologists also refer to this glandular pattern as a clear cell carcinoma.